Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today, I wanted to come on and discuss individual unemployability and how that can be related to mental health conditions like PTSD and depression. So there are many veterans that are rated for for a mental health condition that renders them unemployable and meets criteria to be rated at the 100% level for individual unemployability. So what does that mean exactly? So I'd like to sort of start off by pulling up the VA's guidance from their website to kind of go over with y'all. So hang on one second. Here we go. Okay, so VA unemployed, and this is from va.gov. So VA individual unemployability if you can't work. So it says here that if you can't work because of a disability related to your service in the military, you may qualify for individual unemployability. This means that you may be able to get disability compensation or benefits at the same level as a veteran who has a 100% disability rating. Keep reading to find out if you may be eligible. So who is eligible for these benefits? So it's always best, I always like to throw this out here, to follow up with an accredited legal professional like a VSO or an accredited claims agent or an accredited attorney to get specific guidance on your case, because they should be able to consult with you and really look at the details of your history to see, if the ratings are, if you meet these levels to even apply for it, right? So am I eligible for these benefits from the VA? So you may be eligible for individual unemployability if you meet the requirements listed here. So the following must be true. You can't hold down a steady job that supports you financially, known as substantially gainful employment, because of your service-connected disability. Odd jobs, which are referred to as marginal employment, don't count. So if you are able to do a few things, there's a certain cutoff in the amount of money that you can make a year to be considered individually unemployable. Just really I'm not quite sure what the amount is. It changes from year to year. I think it's around $13,000, maybe a little bit under, give or take. So again, follow up with a legal professional and they should be able to provide you guidance on what is marginal employment. So you can't hold down a steady job, and then one of the following must be true. You have at least one service-connected disability rating that is 60% or more disabling, or you have two or more service-connected disabilities with at least one rated 40% or more disabling and a combined rating of 70% or more. In certain cases, for example, if you need to be in the hospital often, you may qualify at a lower disability rating. So if I'm eligible for individual unemployability, will my disability rating change? It says no. If you're eligible for individual unemployability, the amount of money, your monthly compensation payment will change, but your disability rating will stay the same. So an example, if a veteran has a service-connected heart condition and a 60% disabling rating, she was still able to work until last year, and she began to get chest pain when doing anything physical like walking or lifting boxes. Her doctor told her to retire as soon as possible. She filed a claim for more disability compensation. VA reviewed her work and education history and agreed that she was individually unemployable because her service-connected disability, so they increased her compensation to the same rate as a 100% disabled veteran. So she was still rated that 60% for that condition, but they paid her at that 100% rating. So this page goes on to tell you how to get the benefits. So again, you can follow up with a VSO if you'd like. And here are some instructions on how, the VA is really good about providing instructions on how to file these things yourself. So it says a veteran's application for increased compensation based on unemployability. It gives you the VA form and a hyperlink to it. And then it gives some more instructions here on how to do that. So I would go ahead and check this out if you're interested in reviewing more information about this. It's at va.gov. /disability /eligibility /special -claims /unemployability. And if you need me to post this hyperlink, I can post it for you guys too to go and take a look. And then the VA has their 1-800 number here, so you can call and ask any questions. So let me pull this screen share down. So I wanted to go over some of the literature that our psychologists use in some of these reports that they write. So do you have to have a letter that supports this? No, you don't. You can go and, discuss your history. Maybe you have some personal statements from your previous employers or some coworkers or whatever that can be helpful that discuss your history. You can see I've heard of veterans talking with vocational assessors that may be helpful in some cases. Our psychologists sometimes write reports related to this. So I want to go over some of the literature that is contained in some of those reports with y'all. So some of the things that are important are looking at what are the deficits in the workplace. So do you have difficulty concentrating? Are you having like combative arguments with people at work? Are you having these intrusive negative thoughts that are keeping you off task and making you just really scatterbrained when you're trying to stay focused because you're irritable or you have hypervigilance or things like that. So some of those details can be very important. Do you have, workplace reports that were done on you, like an annual report that says that, shows poor performance or decreased performance? That can sometimes be helpful. So some research on mental health and occupational functioning. You guys can look up some of these reports. They may be helpful to you. So there is one called Depression in the Workforce, the Intermediary Effect of Medical Comorbidity from the Journal of Affective Disorders, that found that mood disorder population is differently affected by several stress-related medical conditions, resulting in greater impairment in the workforce. They also found that mood disorders are the most impairing condition amongst working adults, and it is estimated that approximately 35 to 50% of employees with depression will take short-term disability leave at some point in their job. Another article, Job Performance Deficits Due to Depression from the Journal of American Psychiatry, is another good one that was published in 2006. And lastly, an article titled Partial PTSD versus Full PTSD, an empirical examination of associated impairment, published in Psychological Medicine, showed that work loss among people with PTSD was higher as compared to those who do not suffer from a mental disorder. So really just providing that narrative and some examples. What is the person's previous job history? Do they have transferable skills? If you're combative in the workplace, if you have a very high skilled job and then you're not able to conduct that, can you do a less skilled job? Are you ineffective in most environments? Those kind of details can be important. So I hope this was helpful. Please drop some comments if you guys have any questions, and thanks for watching. See ya.